While different modalities have different approaches to counselling, there seem to be some common factors or non-specific factors that make any kind of therapy successful. This came up because there was a question of, well, we've got all these different schools of counselling, but they all seem to be fairly effective. And also sometimes non-professionals can provide a good job at counselling as well. And what are the characteristics that make them good at counselling? Well, Frank suggested that they all relied on some common, these non-specific factors that made them work. And Glencravage and Norcross compiled a list of these non-specific factors, and we're going to look at those now. So number one is the therapeutic alliance, the relationship between the counsellor and the client. Number two is the opportunity for emotional relief. The client gets the chance to offload, get some things off their chest. Number three is the acquisition and practice of new behaviours, so doing things differently. Number four, the client having positive expectations. So a really important thing is for the client to think that the therapy is going to work. And part of the therapeutic process is sometimes building their motivation and convincing them that the therapy will work if they stick to it. Number five, the therapist being a source of positive influence on the client. So we'll talk about how we can role model acceptance in a later lesson. And then number six, provision of rationale for a client's difficulties. So it's really useful to have an underlying theory of why someone is struggling, because that really helps explain it to the client so that they understand why they're having these struggles, these difficulties, and what they can do about it.